Hey everyone. So I know last time we talked a little bit about mood disorders, specifically depression, and then we moved into a discussion about anxiety disorders. And I gave you the start of a case scenario. And when we get back together, I want to make sure that we get deeper into that case scenario and sort of treatment plan around it. But it struck me that it might be a good time to have a little bit of a conversation about some of the not approved treatment methods that go along with um, depression and anxiety, but kind of some of the sort of pro tips that I've come across that have been helpful for me, things to keep in mind when I'm working with folks who meet criteria for these sort of diagnostic regions. So one of the things that really sticks out to me, or one of the best things that sticks out to me is um, with both anxiety and depression, it's part of kind of the positive psychology movement, the wellness movement that we find ourselves in now, to talk about these on a continuum. And if you think about it, depression is where your mind is existing in the past. And anxiety is when we allow our mind to move into the future and worry about things that haven't yet happened. So depression is where it lingers on what I did wrong and I can't get out of bed because nothing feels good because everything about my life is not happy, is not content. I mean, not everybody's happy. That would not be normal either. But so if we think about it on that continuum, one of the things that we can do with our clients, because if we're dealing with a chemical imbalance of some sort, which many times that's the case, I can't counsel someone out of that chemical imbalance. However, I can sort of challenge some of those messages, and if a person starts to act differently, it can improve what is going on internally for the person. May not be a perfect fix, but it's what we can do. So I think that thinking about that, I think that thinking that continuum of depression existing in the past and anxiety existing in the future when our mind is drifting to one of these other places helps me to kind of think about this for my clients. So if we're avoiding either of those, the best place for a mind to exist is in the present, is in the here and now. And so uh, I've just sort of shared that with my clients. I've talked about what is it that we need to do to keep your mind from getting into these anxious feelings. How do we sit here? Like, how do we try to keep focused on what we're dealing with here? And so one of the things that's really useful with that is grounding exercises, helping our clients to notice things that are happening in the moment. Breathing is another thing. Um, so if you think about it, our mind and our body do things together. So as our mind moves into anxiety, there are certain symptoms that creep up for us. So, like for myself, to use myself as an example, when I start to get really anxious, I breathe more, and this is pretty common for a lot of people. I breathe more rapidly and more shallow. So my breaths are not deep and methodical, they're short and rapid. Um, my my mind starts drifting and I'm not paying attention to things that are going on around me because I'm worried about whatever is coming. Um, and so, ways to ground yourself are to purposefully breathe calmly. So, force yourself to take deep breaths in and out slowly and methodically. Breathing will actually reduce anxiety and panic heavily on its own. Another thing to do is to force your mind to come back into the present, and so avoid letting it get to the fear. Focus on things that are happening right now. Think about the feeling of your feet on the ground, how your clothing feels on you, the way that the chair feels as you sit in it. um, there are various formulas for doing this. Look at five things that you can see, think of four things that you can hear, three things that you can taste, whatever the case may be. But it gets your senses to engage in what's happening now as opposed to letting your mind drift. Doing that in session with our clients can be extremely effective to teach them. Getting them to practice it and bring feedback back can be really helpful. Another thing that I tell clients who are stuck in depressed feelings, it's a very similar sort of process, but I get them to think about, you know, depression is telling your body that it has no energy for the things that you love anymore. It has no energy for anything that makes you feel productive. And so it becomes very self defeating. Instead, try to fake it till you make it. And that sounds ridiculous to folks who are really struggling, but it's true. So think about the things that you would do if you were not depressed and do them. Force yourself to do them. As you do them, you will feel less depressed. It's not perfect. It's not going to take everything away, but that's what happens. So both anxiety and depression become these sort of self-fulfilling experiences. The more anxious we are, the more we feel fearful, the more we panic, the more our mind is moving towards the thing that's anxious. The more depressed we are, the more our mind sits with the depressed feelings and prevents us from doing the ththings that are going to make us feel well. Yeah, I don't always feel like going out, but sometimes if I force myself to go out, I enjoy it. Um, you know, I I love watching movies. I'll feel like I don't have time to do that. If I make myself do it, but I have to watch the movie to enjoy it, not in the background while I'm doing work or something like that. I have to go out. I can't be on my phone checking emails when I'm doing that. That's not helpful. Do the thing and be present while doing it. That will reduce the symptoms of either of these. And the fake it till you make it. Think about I used to tell my clients who were struggling with substance abuse this stuff, like, don't do the old behaviors that you used to do when you were using. Do the behaviors that a recovered person would do, even if it doesn't feel right. You know, reach out to your sponsor. So in this case, call another human being, even if you don't really want to talk, but be honest about it. Like, I wasn't really feeling like talking, but I think I need to. Can we talk about something right now that'll take my mind off of some of this stuff? You know, those are the things that I think are important to realize. Depression and anxiety are both insidious, and as I said in class, they are uh, they are often things that folks who are not experiencing them will tell you just don't. And that's not realistic. So instead, let's be honest about, and this is what I tell my clients, let's be honest about what it actually feels like and what you're struggling with. And then let's figure out a way to just do it anyway, what needs to happen. You know, when I was exercising more regularly, I did not feel like waking up first thing in the morning and jumping on my elliptical and doing my walk and whatever, my brisk walk, but I did it anyway. And then after I did it, I felt great, but I never wanted to get up and do it. It has never felt good to me to intentionally go and exercise, but I know I need to do it. Some people it works, doesn't work for me, but I still need to do it. So the same thing, anxiety, calming your mind, depression, pulling yourself out of the throes of that. None of it feels right, but you have to do it. So I find it better to not lie to ourselves about what's going on, and I tell my clients that too, and to just be honest about this sucks, but I'm going to try to do something different, anything different. And even if it's not exactly what I need to do, even if I did something, it's much better than nothing. So hopefully that's helpful to frame your thinking around the symptoms and the experiences, and also how to get to trying something different and something practical that can try to help you with your clients. Look forward to talking with you again next time.